A string of violent attacks on Toronto transit are sparking conversations around the safety of public transportation. Toronto's police chief says the force is increasing its daily presence on transit lines. Meanwhile, the city has called for a national summit to tackle the mental health crisis. Ontario Premier Doug Ford and Ontario Health Minister Sylvia Jones addressed the issue earlier today.
I appreciate Mayor Tory has come up with a plan, but it's a Band-Aid solution. We need full-time police officers.
Deeply disturbing to hear about youth that are so disenfranchised that they feel their only pathway is to attack strangers in a publicly funded TTC.
So what can be done? One transit worker union is calling for all levels of government to create a national task force as a first step. John Di Nino is the president of the Amalgamated Transit Union Canada, which represents 35,000 transit workers across the country. Thank you so much for joining us, Mr. Di Nino. I'm just curious, why do you think that a national task force is the way to start tackling this issue?
First of all, thanks for having us this evening. We think that, it's a first good step in trying to determine what's going on in our transit properties across this country. These incidences in Toronto are not isolated just to Toronto. We've seen a significant increase in uptick in transit violence right across this country. And we think it's imperative that all transit agencies get onto the same page, figure out what some of the root causes are, and how we address them collectively so we can stop these attacks right across the nation.
In Toronto specifically, as someone who lived in Toronto for about a decade and relied heavily on public transit, watching from the outside, and I know it's happening in other parts of the country as well, as you mentioned there, is there any idea as to what is leading to this increase or this spike in what seem to be random attacks? Is there any sort of understanding as to what's going on right now?
Those are things that are very difficult to determine, but some of the things that we're talking about, and like the mayor, we're talking about mental health issues. And we honestly believe that we need to address some of those issues. People have just come out of a pandemic where they have suffered a lot of trauma and mental health issues by being locked up. The economy has turned for the worse. Interest rates are at an all-time high. Inflation rates are compounding the situation, and people are struggling. And as we see the decline in ridership, the increased cost of rides, the decrease and cutting back on transit routes by municipalities. I think these are things that all complicate people's anger and frustration with our frontline workers. The decisions are made by the stakeholders, and our people in uniform are on the front lines and taking the brunt of this.
How are frontline workers feeling in this moment?
Frontline workers are absolutely terrified. That's the only way I can summarize it. We've had numerous calls in our office from our members. The anxiety, the uncertainty, they don't know if they're going to go into work one day and not be able to go home or go home injured. There's an extreme unrest and fear factor amongst our members.
What do you think needs to happen in the immediate sort of future? I know that the Toronto Police Service has decided to step up the number of officers on public transit, so there's a more visible presence there. What other kinds of supports are you looking for not necessarily lasting solutions, we can talk about that, but just interim, immediate, okay, we need to relieve the pressure and make things just safer?
So we have said that some of the first steps would be some added vigilance and visibility by the Toronto Metro Police and special constables right across Toronto and every other municipality across this country. But we do need to look at some of those longer term issues. We want to talk about mental health awareness training for our frontline professionals who may be able to see something ahead of time, understanding what that looks like, and then offer them de-escalation training on how to move in and work on some of those very difficult situations. We need support from mental health officials. We need increased funding to be able to sustain some of these programs in the public transit sector. We know that transit agencies are starving for funding. This is an added burden of cost, and I think this is where all levels of government need to step up and assist public transit across this country.
Are you starting to see any sort of trends that people are leaving the profession? This is not something that just happened overnight. I know there's an explosion of violent incidents lately, but have you started to see any sort of shifts in employment, people leaving because of concerns on the front line?
We haven't seen those shifts. I think it's still early, but what we have seen is the reluctancy for people to want good paying jobs in the transit industry and the reluctancy to join transit systems across this country. And the members that are there now are second guessing themselves. Why would you want to go into a job when you know is going to be unsafe? Employers aren't taking every reasonable precaution to ensure the safety of their members and their workers. And we saw the resource shortage through the pandemic, and we're seeing more and more that there is a reluctancy to enter into these positions.
On the flip side of that, are you seeing any changes in passenger ridership?
Sure. The TTC has reported that they're at about 69% pre-pandemic numbers. I think as these incidences have escalated, people are going to be more reluctant to get back onto the transit system. One of the things that we've always professed at the ATU is our transit professionals want to be able to provide safe, reliable, affordable, and accessible transit. And if we can't deliver those kinds of things, transit is going to be starved of riders.
You've got a national audience here. The Prime Minister was asked about this week, about what kind of support the federal government could provide. What do you think the federal government could do in this moment to help make transit safer?
I think the federal government needs to move on this issue very quickly. I think the federal government needs to convene a meeting of the stakeholders, including the ATU, and we're prepared to facilitate this. And we've mentioned that over and over again. Just today, we've written to the Prime Minister and the Federal Minister of Transportation calling for an urgent action. This doesn't have to be where people fly in from all over the country. We can do it on Zoom or Skype and these kinds of things. And we need to get to the table and put staunch solutions and funding models and all of the best practices in place immediately.
Please let us know when you hear a response to that letter. Thank you so much, John Di Nino, President of the Amalgamated Transit Union Canada.